of today is looking at livelihoods and the economy. I think we have an excellent lineup for today. I do want to introduce Jung-Won Kim, who is our postdoc on the project at Harvard University, who has been so essential to helping us put this symposium together, as well as Wendy Guan, who's the director at the Center for Geographic Analysis at Harvard. That is also helps us with so many things that have to do with this project. And if you go to our website, there's the program book there where you can read more about the C2M2 program. You can read all the abstracts of all the presentations here. And also on the website are a number of student projects. We had students participate and create a number of posters from these things. And so you can be able to look at those posters and see some of the preliminary results that we've been starting to get together from our projects from around the world. Just a reminder about ways to communicate. Please drop your name and information in the chat. Please also tell us in the chat if you're having any technical issues. We'll try to assist you with that. Please also, as we have the discussion and the presentations, we will have time for discussion, we hope, as we manage that time element. But put your questions in the Q&A, which is a little box down at the bottom of your Zoom screen, and we'll be tracking those questions to try to answer them. And just another reminder to fill out the survey when you leave the symposium. Can we go to the next slide, Jung-Won? So just to cue you up for today's project, for today's activities. The C2M2 program is built on partnership, collaboration, and networking. And we feel that all of these aspects provide the ability to ensure sustainability. It's so important for these kinds of activities and projects to figure out how we can make this sustainable. The pandemic provided an opportunity to build on an expertise developed at the Department of State's project, the Secondary Cities Project, which was a field-based initiative to map secondary cities for resiliency, human security, and emergency preparedness. From that activity, we had the development establishment of what we call regional hubs. So yesterday, we were able to have our Asia hub lead, Nama Budhataki, be able to be part of our panel session to talk about some of the activities that's going on there. We have an Africa hub where Gaston will be highlighted today also as part of our panel session. And then tomorrow we'll have our Latin America hub participate as a panelist, Carlos Mena. So building on this suite of expertise, we were able to establish this C2M2 project that examines second-order impacts of COVID-19 through a geospatial lens. And not only were these important hubs from around the world, this expertise and partnerships valuable, but also the suite of partnerships we have here with our supporting entities, from the American Association of Geographers to the NSF Spatiotemporal Center and the Center for Graphic Analysis at Harvard, all of these other entities that help to support this. So this is a work of many people. This is not just an individual-based project. This is bringing partnerships together to try to address this critical issue. And so with that, if we could go to the next slide, Jung-Won, I'd like to introduce Laura Klein. So I've worked with Laura now for a number of years, and it's truly a privilege and a delight for me to be able to introduce her. She's a geographer at the U.S. Department of State in the Office of the Geographer and Global Issues, and also in the Humanitarian Information Unit. She's the director of special programs for that office, and she's also the program director for our C2M2 project. And with that, I really don't want to take a whole lot more time, but I'm going to pass this off to her. So welcome, Laura, and we look forward to today's session.
Hi, Mel, and thank you so much for that warm welcome. Good morning, good afternoon, and good evening, all, depending on where you're calling from. As she mentioned, my name is Laura Klein. I'm the director for our Cities COVID Mitigation Mapping program, as you'll hear referred to as C2M2 throughout the day. And it's my great pleasure and honor to welcome you here today to get us started here for the beginning of a great set of expert speakers and also discussion opportunity. We have Q&A sprinkled throughout the day. We really hope you do ask questions, get engaged. As Dr. Laituri mentioned, if you would go ahead, the chat is great for sharing some information. But if you do have any questions specifically for the speakers, I'll be looking for those in the Q&A button that's there at the bottom of your screen. So to get started, our Cities COVID Mitigation Mapping program, we kind of, a year ago, it's hard to believe it's happened so quickly and yet so long ago, we began developing this program. And even back then, we had the idea that we really wanted to have a symposium. We wanted to have an opportunity that we could bring together both the academic experts, our international practitioners, and our networks, because we have pretty broad networks across the world with all the different organizations involved. And so you're here today as part of our audience, our participants, and we hope contributors to the conversation. And we have identified 3 key second order impacts, or should I say, our C2M2 projects, the 12 cities and the 3 regional hubs which support them, have identified key second order impacts that they've been seeing throughout the year in their countries. So we had our migration and mobility session yesterday. We will have, of course, this livelihood session that you're joining us here for today. And tomorrow we'll look at gender and a lot of different nuances to gender, but we felt that was the best organizing principle to kind of pull it around. Again, it's been about a year, and it's been just tremendous to see all of the hard work that our C2M2 projects and all of our research partners and everyone have pulled together. We've been creating and contributing to this body of knowledge on COVID second order impacts that had never been heard of before. I mean, nobody knew COVID would be an issue, nor did we recognize the sort of wide-ranging and interconnected impacts that would occur. So we couldn't do that without our partners. Of course, deep, warm thank you to our C2M2, the 3 regional hubs for Asia, Latin America, and Africa, our 12 project teams. Also, great thank you to, as Dr. Laituri already mentioned, to the Harvard University Center for Geographic Analysis, Dr. Wendy Guan, Dr. Jungwon Kim, who have been so instrumental in this. They've also organized and led a group of student interns for the past year who have contributed some great academic research and have created the posters that you have access to through the event website. We couldn't do this without our managing partners at the American Association of Geographers, our longstanding partnerships we have with them. And of course, this wouldn't be possible without the support of the US State Department, where I come from, but also many of my teammates who have been involved in our humanitarian information unit. Lastly, I have to extend my personal thanks to Dr. Melinda Laituri, who started us off here this morning, and our dedicated teammate, Dr. Jungwon Kim. We really appreciate all your work that you've done throughout the program, but throughout the entire C2M2 program. But of course, pulling together this symposium has been quite a feat. And it was such a great opportunity yesterday to listen to our speakers. We look forward to today. In getting us started and focusing our attention on livelihoods, it took me back to my early years of academic research when I was looking at urban heat islands. And something that really stood out to me with regards to urban issues was that my advisor described urban heat islands as that leading indicator for what we would see longer term and larger scale with climate change. If we move that analogy over to human geography, which I spend much more of my time working on these days, I see that urban issues around the world can often help us understand the social, the economic, and the political drivers at the national and regional scales. And what we did with that model, with our assessment of second order impacts, is we continued it one step further. By looking and conducting research in support of vulnerable urban communities, so at the suburban scale, this can help us understand the worst of the second order economic impacts upon livelihoods, because this pandemic really has magnified many of the existing inequalities that were already present before the pandemic. If you missed it yesterday, everything was recorded. We hope that you go back and check it out. But a couple key highlights from yesterday that I think really tie into the theme that we had today. Our keynote speaker from yesterday, Mr. Lars Peter Nielsen from the ACAPS organization, left us with a call to action. He said that second order impacts will evolve and continue for many years, and that we have a duty to continue to research and address the impacts upon the most vulnerable. Taking that one step further, one of our panelists, Dr. Nama Budatoki, who is also the lead for our C2M2 Asia Hub, shared his expertise and a great phrase, which I'll continue to remember. He said we need to bring science to society, that there is a tremendous impact to be gained by focusing on bringing the data to the decision makers to ensure that data and research is used and beneficial. And the final highlight from yesterday actually came from our opening remarks, which were delivered by the Geographer of the United States, Dr. Lee Schwartz, from the US State Department. He implored us to consider how to use geospatial data to tackle second order impacts of COVID-19. He was very deliberate in his use of the word tackle. I've never actually heard him use it in this sentence or in this situation before, but he really wanted to focus our attention upon using geospatial data, analysis, and visualization or storytelling to support human security around the world. So yesterday's conversations around migration and mobility have actually set us up very well for our discussions on livelihood impacts today. Yesterday, we heard about the impacts of mobility restrictions upon the tourism sector. However, today, of course, we'll consider a much broader set of economic activities, looking not only at impacts of changing mobility, like we addressed yesterday, but looking at changing supply and demand. Similar to yesterday, we will consider the interrelationships between the global, regional, and local scales, and consider the local partnerships that are so critical to our understanding at each of these scales. Our panelists and lightning talks will illuminate the current state of second order impacts. And in closing, our keynote, Dr. Francis Koti, will share a potential glimpse of the future. We hope that you stay with us throughout the whole symposium this morning. But if you have to leave early, please keep an eye out for our survey link, end of day survey link. This is yet another opportunity for you to share with us your thoughts, your comments. It's an anonymous survey, but at the end, it does offer you the opportunity to either share your name and or project that you may want to work on or may want to share with us, or it gives you the email address for our mapgive.state.gov team, where you can reach out and we can get you connected to the right team. So without further delay, let's start into our panel for this morning. These three international experts focus their research and activity upon livelihoods. Throughout the day, our experts will share the tools and techniques that they have applied to examine second order impacts. And I invite you to consider what's in your own toolbox. If you see opportunities for creating new partnerships to help mitigate the impacts of this global pandemic, please reach out and please connect. We all have a role to play here in mitigating and ending the effects of this global pandemic. So our first panelist is Dr. Robert Richardson, who is already up here on screen, I see. His topic will focus on COVID-19 barriers and drivers of livelihoods in the economy. And as a way of introduction, I've had the pleasure of working with Dr. Richardson for many months now. He came on board almost at the beginning of our C2M2 program with our team, but he comes to our office as an agricultural economist and a professor at the Michigan State University. His research interests lie at the nexus of the environment and development, particularly the contribution of ecosystem services to socioeconomic well-being. He has more than 15 years of experience conducting research related to food security and the environment in several countries throughout sub-Saharan Africa, Latin America, and Southeast Asia. He's currently serving as a Jefferson Science Fellow at the US Department of State in the Office of Geographer and Global Issues, where he is supporting our Cities COVID Mitigation Mapping program, among the many other tasks that he's willingly taken on in our office while he's been here this year. With that, it is my great pleasure to introduce Dr. Richardson and turn it over to you for our first panel talk today. Thank you.
Thank you, Laura, for that kind introduction. I'm just going to bring up my slides now. It's a real pleasure to join all of you from different parts around the world for day 2 of our C2M2 Symposium. So I wish you good day. And I'm going to just introduce a broad overview of COVID-19 and livelihoods. So certainly throughout the COVID-19 pandemic, governments around the world have faced this trade-off of having to confront the decision of protecting lives and protecting livelihoods. And they have sometimes come at the expense of one another. In so doing, we have faced a global health crisis and also related socioeconomic impacts. And those have come in the form of border closures, workplace lockdowns, stay-at-home orders, and other kinds of restrictions that have impacted livelihoods. Those responses have significantly affected the livelihoods of those working in numerous industries. One can easily think about travel and transport, which were almost ground to a halt through much of the past 15 months. The hospitality and tourism sector were, certainly that sector was significantly and negatively impacted, and also the informal economy. And this is not a complete list. The distribution of labor income losses was highly uneven. Most of the data suggests that women and youth were among the most negatively affected, and that there were disproportionate impacts faced by self-employed workers and low-skilled workers. As you can see in this chart, every region of the world has been negatively impacted from an economic standpoint throughout the year 2020. On average, global gross domestic product contracted negative 3.5%, but it was much higher for advanced economies, nearly 5%, and for Latin America and the Caribbean, more than 7%. So again, the effects have been uneven, but largely negatively experienced by the entire world. One can think about restaurants as a sort of emblematic example. You can see from this chart in April of 2020, across about 8 countries that were included in this analysis, restaurant activity in terms of seated diners fell almost entirely to about 100%, and then rising again, but dropping off at the end of 2020. If employment growth had continued on pre-pandemic growth rates, you can see from the chart there, the pandemic as related to a no pandemic scenario generated 144 million losses of employment, billions of people in this chart, 144 million employment lost relative to a no pandemic employment growth scenario. So this is not an insignificant number. If we look at a world map, we can see working hours lost. Some countries, particularly in Central America and South America, experiencing up to 25, 27% of working hours lost on average. And again, keep in mind, these are averages, so they obscure some regional and industrial or sectoral level effects where the working hours lost would have been much more significant compared to the average. If we break down those working hour losses into regions, we can see that they were most acutely felt in lower and middle income countries, but felt negatively in terms of working hour losses by all types of countries. And then regionally, we can see that the Americas as a region was most acutely impacted in terms of losses of working hours. These were related both to unemployment, inactivity, so departing from the labor market altogether, and then also those who remained employed but incurred reduced or zero working hours. This is an interesting chart that shows hours worked per person declining very sharply in the year 2020, particularly in the second quarter, as you can see on the right-hand side panel. I would just put this in some context for you. If you look back at around 2009 and the so-called Great Recession that so negatively impacted employment and economies around the world, you can see that it's just a tiny blip as compared to what happened in 2020 in terms of the losses of worked hours, hours worked per person. When we look at the distribution of the share of income losses from labor, again, lower and middle income countries felt this most acutely, but all areas of the world, every continent, incurred labor income losses. In terms of the distribution of labor, those who stopped working since the COVID-19 outbreak, you see, again, occurring quite profoundly around the world. West Africa, much of South America, much of Southeast Asia and South Asia, some countries between 50 and 70% of respondents stopped working altogether since the pandemic. And then in terms of those who experienced a decrease in total income since the pandemic, we see some countries up to 85% of households experiencing a decrease in total income. This is occurring at a time of rising food prices. And again, I hope you can appreciate the blue curve representing 2021 over at the top. Food prices on average globally are roughly 40% higher than the same period last year, and roughly the same increase higher over most of recent years, including 2017, 18, and 19. So this impact on livelihoods has had a kind of double whammy, if you will, in terms of income losses for many amid a concurrent rise in food prices. Finally, how have households coped with this situation with losses of livelihoods? Many have used emergency savings to cover basic living expenses, up to 60% of households in some countries. And even more so, households have coped by reducing their overall consumption of goods as a coping strategy, above 90% of households in some countries. So to conclude, the COVID-19 pandemic has had profound impacts on livelihoods globally. They have been widespread but unevenly distributed. The impacts were worse among already vulnerable populations and most acute in middle and lower income countries. These impacts were compounded by rising food prices, leading to rising food insecurity. The findings of these data highlight the importance of social protection programs, things like targeted insurance-based benefits, minimum income where countries offer that sort of thing, temporary cash transfers, and other safety nets to protect society through economic shocks such as those wrought by the COVID-19 pandemic. Thank you very much.
Thank you, Dr. Richardson. That was a great speech, and I'm just trying to turn off the timer here quickly. But so for anyone who has any questions, I don't see any in the question answer, but please do insert it here. We do have a couple minutes left for Q&A. So I'll start us off. Robbie, you've had an opportunity to really examine much of the literature that's come out with regard to COVID-19 and the second order impacts. For those of you that haven't seen it, there's a resources tab up on our mapgive.state.gov/C2M2 website that is all this research that Robbie and Dr. Kim and others have conducted. But what were some of your some things that surprised you out of the research as you examined it here over the year and you saw things progressing? Or were there certain gaps in the literature that you expected there to be something that didn't exist?
Yeah, thanks for the question. What I found very interesting and maybe not so surprising is how closely the socioeconomic impacts tracked with the spread of the disease. So countries like the United States, for example, Italy and Spain and Brazil, where the disease had such far-reaching effects, those countries also had very negative socioeconomic effects and impacts on livelihoods. What I found a bit surprising is how closely related today's topic is to yesterday's topic. It's very hard to separate some of these second-order impacts, but because of the loss of livelihoods and the negative impacts on livelihoods around the world, many households and individuals were compelled to migrate. If they lost their jobs in the city, many people were compelled to move to their rural home to rejoin with family. And so the impact on livelihoods in some ways was related to the impacts on migration. And this has rippling effects in terms of losses of remittances that would have normally been transferred back to rural households. So I think, yeah, in summary, what I found so interesting about all of this is how intertwined so many of the second order impacts of COVID-19 have been realized and manifested around the world.
Yeah, absolutely. I do see we have a hand raised. We have a brief moment. Jungwon, if you can allow Elmond Banaduko to ask his question, and we'll see if we can answer it now or if we'll save it.
Yeah. Do you want him to ask a question right now?
Sure, he can go ahead and ask
yeah.
it, and then we'll see if we have an opportunity to answer it now or fit it in at the end of our session.
Yes. Elmond, now you can unmute yourself.
Yeah, thank you, Rob, for the presentation. I have a question on some of your recommendations in terms of social protection. Like, how do you see that working out? Maybe in the context of developing and developed countries, and also their appropriateness in an urban context.
Yeah, thank you for the question, Elmond.
I think that's great. Robbie, if we can hold that to the end of all three panelists, sure. I think you and some of our other panelists will have a great set of contributions to make to that question. And then I also see we have a couple questions coming up in the Q&A that we will certainly get to, if not during the panel, throughout the day. So thank you, Dr. Richardson. Now we'll move on to our next panelist, Ms. Fikriyah. She is a PhD candidate at the University of Illinois at Urbana-Champaign. Her dissertation research focuses on examining the everyday lives of Indonesian female domestic workers in Hong Kong. She draws on the concepts of therapeutic landscapes and networks in health geography to understand the health and well-being of women who work in domestic employment, especially their access to places and social networks within restrictive time and space constraints. Ms. Winata also uses GIS, spatial analysis, and statistical methods to examine disparities in access to healthy food in Chicago, Illinois, and the availability and accessibility of primary healthcare services in Indonesia. Prior to attending graduate school, she was a GIS instructor and GIS specialist at Esri, Indonesia, with multiple GIS certifications. And we look forward to hearing today her discussion on therapeutic landscapes and networks amongst Indonesian female domestic workers in Hong Kong during the COVID-19 pandemic. Ms. Winata, if you're ready.
Yes, thank you so much, Laura, for a great introduction. I do apologize. I might not be able to open my video because I got kicked out from Zoom anytime I open that. So I'm really sorry about that. I will try to share my screen. Can anyone see my screen?
Yes, we can see your screen and I see it's in slideshow mode. You should be ready to go. Thank you.
All right, thank you so much. Hello, everyone. Thank you for having me today. I'm Fikriyah Winata. So my work has been focusing on investigating the everyday life of Indonesian female domestic worker in Hong Kong, especially especially their space-time constraint, and also during the COVID pandemic. I want to know how this pandemic actually impact their livelihood. So I would like to start with these pictures here. So in the right side, this actually a picture from New York Times. So the Hong Kong government eventually backtracked on a plan to require COVID vaccination for domestic worker. And in the left side, picture showing female domestic worker actually line up to get COVID tested. So they had to test COVID before May 9th, which was last month. So just a little bit background about female domestic worker. They are highly vulnerable, especially due to two things: the intensive work responsibilities and also the demanding daily tasks. We know that domestic worker is really demanding work. And for there is actually the collocation issue when female domestic worker in female domestic worker livelihood, especially when these female domestic worker in Hong Kong, they live with their employers. So their place of life, which they live in their employer home, and their place of employment are actually in the same place. So there is a lot of issue with personal freedom, sense of privacy, and so the public places might be an option for them to actually get this as the aspect of life, especially how to get the well-being. And they actually can do that on the rest day. So I will really highlight why the rest day is really important for female in this domestic employment. However, due to the COVID pandemic, female domestic workers could not benefit from their rest day as much as they experienced before the pandemic. So some of my research participants said, oh, before the pandemic, I used to go to Butterfly Beach, but now even my friend, they couldn't get out during the rest day because their employer asked them to not going out anywhere. And then, so my study drawing the two concepts in health geography, the therapeutic landscape, in which this landscape can associate it with healing, treatment, and where people visit those places, they can feel happier, they can feel good about their life. And also the therapeutic network. This is actually really important, especially during the pandemic, because we need more support because we got isolated. And so the concept of therapeutic network itself is the presence of the agent of support, such as from family and friends. And in the context of domestic worker, the presence of their friend who also other domestic worker are really important in the everyday life. So they build that connection. Besides, they also visit places. So I collected data in an individual level assessment through the activity diaries, a virtual interview. Again, this is COVID, so I couldn't go to Hong Kong because Hong Kong border is still closed. So I did a virtual interview and also gather a survey, health and well-being survey. And I collected the data on August to December. Keep in mind, because during that time, the COVID policy in Hong Kong also changed, especially here, for instance, from August to December. I highlight several changes here, especially in terms of gathering restriction, because in terms of talking about social connection, so gathering is sort of like important to see, and here they also get the limit, especially for instance, we see in December, the gathering maximum only 2 people. So what that's actually imply. So I want to show you here is the maps of, I mentioned that rest day is very important because domestic worker use this rest day to go out to do any activities not related to their job, right? So we can see here, this is from the activity diaries. In rest day, domestic workers can go to a lot of different places, while in a working day, their mobilities and their space and time are really restrictive, and it's related to their work tasks. So we can clearly see here the differences of the activity path during the rest day and working day. And then I also map the distribution of the activities, like the location of their activities. And I also create, this is like how much they actually spend time outside their employer's home. We can clearly see here, there is a significant difference between rest day and working day. And in rest day, domestic worker can go to many places and spend more time outside their employer's home. And then it's really interesting because before COVID, these are two pictures before COVID, when they actually can have more activities and meet more people. While during COVID, they seems like, I can go only by myself or maybe only with two people, because again, like that's gathering restriction. And also the limited like public places actually open during COVID pandemic. And I derived this from my activity diaries, interview, and also the survey, and how actually COVID-19 impact the female domestic worker livelihoods and also life in general. And some people told, some of my participants told me that, oh yeah, I don't have any activities outside my employer's home. I even couldn't get a day off. So they actually just stay at home even during the rest day. So, and then said, yeah, I miss my friend because now I can only talk through WhatsApp. Most parks are closed. Again, this is, remember, during that timeline of my data collections. And also, this is very interesting because some of domestic workers, they use their rest day to get some additional income, such as they sell some food, some products, and also they provide like some massage services. However, because of the COVID-19, this opportunity to get additional income, they lost it. They said like, oh yeah, now nobody book me for the massage services because of COVID. And they said like, oh yeah, now I cannot just go out and sell food because of COVID as well. So they lost that opportunity as well.
One minute, please.
Yes, and then also they couldn't attend any other activities, such as before COVID they can attend language class, but now they're like, oh, I couldn't attend those activities anymore because of COVID. So lastly, this is actually my last slide in terms of my content. So we actually developed some statistical model as well to confirm, and then because of these limited of places, our quantitative modeling couldn't find the association between the therapeutic landscape and self-rated health because of the limit of use of the public places itself as their therapeutic landscape. However, for the network, we still found the association, which tells that the domestic worker actually utilized some digital platform to get connected and to do like social network. And this is some activity I help one nonprofit organization to have like online activities for domestic worker in Hong Kong. And lastly, I wanna, this is our book chapter. If you're interested in COVID in a geographical approach, I will share the link through the chat box if you're interested in to read our book chapter just published actually yesterday. Thank you so much for listening, and I will take questions.
Thank you so much for that very interesting and insightful look. These second order impacts of COVID are so wide ranging, and this is certainly one that I haven't heard of yet, but it sounds like such a tremendous, an important set of work and thing to understand for this group of people. I don't see any questions in the chat or the Q&A. But let me set out one of my own. Can you speak a little more to the partnership that you created with the local, I think you called it an NGO? And are there other ways in which you've shared your work? These book chapters look great. You had some outstanding GIS analysis and products there. If you could speak a little more, please.
Yes, so thank you, Laura, for that question. I actually have one question from the audience here, but I will answer your question first. So I work with Dompet Duafa Hong Kong. This is their logo. It's actually the NGO, nonprofit organization. They focus on religious, social, and providing like some activities for domestic worker. And they actually helped me a lot for the data collection, especially for the participant recruitment. And then this Dompet Duafa, because like in Hong Kong, there's just a lot of domestic workers, not only from Indonesia actually, but also from the Philippines, from Myanmar, from Thailand. So my partnership with Dompet Duafa mainly for they help me for the research, like for recruitment, and in turn, on winter break in January, February, March, we actually try to think about, oh, maybe we can facilitate some activities for a domestic worker through the Dompet Duafa. Especially we create English, Hello English. That's actually I created with Dompet Duafa just because we want to help the domestic worker to have more activities. That's like online activities. I'm in the US, of course, and they're in Hong Kong, so we do some sort of like English classes to help them. And my GIS, I feel this is sort of like I touch when I got invited from Dr. Kim, was like, oh, the team are migration, gender, and livelihood. That's really speak to my research, because I touch almost like 3 of them, and that's I use my GIS skill to sort of like touch another dimension, another like issue. Especially I think gender issue and livelihood and migration are very important, especially now during the COVID. We know, especially through this symposium, I think it's really important. And I use a GIS skill and my geographical approach to better understand their life, especially how this restrictive space-time concern that the domestic worker experience in their everyday life.
That's outstanding. Thank you for sharing that with us. It's a great way to consider, mapping their daily activity and understanding their life. And certainly one as a geographer, I ascribe to myself. Thank you. With that, I see we do have a couple questions in the chat for you.
Yes. There is a questions from Mia. Is there any insight as to what policy programs are in place to domestic workers, especially considering the effect of the pandemic and the structural?
Now it's my pleasure to introduce Dr. Gaston Mbonglou. He is a senior executive with a proven track record in business strategy, operations management, and information technology. He's a principal at the UASG Advisors and vice president of operations at the Capstone Strategy Group, a company focusing on process improvement and the use of technology to drive organizational efficiency. Prior to joining Capstone Strategy Group, Dr. Mbonglou held multiple management positions at KPMG. Since 2017, Gaston has provided strategic leadership and project oversight for the U.S. State Department's funded projects in Africa. And since 2020 is leading the Cities COVID Mitigation Mapping, our C2M2 hub in Africa for geospatial activities there. He's the co-author of the Accelerating Business Growth in Emerging Economies framework, a strategy centered around capacity building through entrepreneurship programs in emerging economies. Dr. Mbonglou has held the position of adjunct associate professor at the University of Maryland University College as well. He holds a PhD and a master's degree in computer science from the University of Technology in Dresden, Germany. And he's here today to share with us how they've used geospatial data to understand and mitigate second-order impacts of COVID-19 on education, healthcare, and the economy. With that, Dr. Mbonglou, Gaston, please enlighten us here today. Thank you.
Wonderful. Thank you so much, Laura, for the great introduction. I'm very happy to be here, and good morning or good afternoon to all the panelists. So we're going to share a little bit about what we have learned in the Africa Hub with regard to the impact on livelihood and some of the lessons learned as some of the local officials really start looking at how to mitigate the impact of such pandemic. So let's go to the next slide. Let's go to next. It's much easier. Yeah. Okay. When you look at the Africa, we're basically focusing on 3 cities in 3 different countries. The first one is Nairobi, Kenya. Nairobi, it's a hub, as you all know. And one of the things that we really look at in Nairobi are settlement. You know, one of the challenges you have in those settlements is access to water. When you look at COVID-19 preventive measure, one of the key things is to wash hands. If you don't have access to water, how are you going to wash your hands? The second thing we are looking at is really the impact on business and mostly informal business. As you all know, in Africa, the informal sector is very contact intense. You go to the market, you meet people. If I have my protective measure, how am I going to be able to go to the market? How am I going to be able to sell my food? It is a challenge. And then the third aspect is really education. as you start going through closure, a lot of parents were forced to keep their children at home. But without any way to really provide remote education, some of those children were left by themselves. And one of the things that we saw is, for example, a lot of pregnancy with young girls. So how do you manage those challenges? And also the overall exposure of, some of the healthcare professionals. So those are the things we're going to really share with you, because that was really the challenge that many countries face, that balancing act. So as you go to the next slide, you're going to realize that throughout the year, it has been a balancing act between the government trying to protect people, the population. As soon as they start applying restrictive measure, of course, the number of cases go down. As the number of cases go down, they start relaxing the measure and the cases go up. And this is a vicious cycle that people have been going through. And to really help some of the local officials understand what it means, it was important for us to harness some data, collect some data, and present the impact on some of the different population groups. But more importantly, also something that's happening, in some of the developed countries, we think as you get more people vaccinated, it's making the way easy. But as you look at many countries where we work, you do have some anti-vaccination, movement going on, and that makes it really difficult also to get a lot of people vaccinated. And if you look at the next slide, you're going to realize that some of the countries that we're focusing on, be it Kenya or the DRC, we have a very low level of vaccination. This is from the African CDC. You barely have 1% of the population in Africa that has been vaccinated. That is not good. And as you look at the next slide, we're going to show you the real impact. So let's take Pemba, where we had a chance to look at the data from the beginning of the pandemic from January 2020 to now. You can see by February 2020, when the pandemic really hit, almost everything went down. So you look at hotel workers, they lost their job. Because they lost their job, they couldn't pay for their children's school. If they can't pay for children's schools, it started creating challenges. And every time the government tried to relax the measure, you can see the little peak. People go back out, they start walking, and again, the number of cases goes up. And that has been the vicious cycle in and out. When you look at Bukavu, where we have been collecting some data for the last, Q1 2021, you can see what's happening with the healthcare workers. Because of the exposure, a lot of people have been sick, and you have few people at the hospital. You can see in some of the both clinic and private clinic, and even the major hospital, early on you had a lot of nurses, but in general, by March, few people were there. So as people get sick, where do they go? So that was really a challenge, because not only was the population impacted, but you also have some of those front workers that were extremely exposed to the whole challenge. And that was really important to us, because as you go into a project like this one, it's very important to understand what type of data do you want to harness in order to be able to really help people make the right decision. And that takes us to the next slide, where before we got started with the project, we have to define a framework. The whole idea is, what do you want to achieve at the end of the day? The goal for us was to be able to define some KPIs and metrics that can be used by a local official to have a better idea of what's happening and be able to define policies using geospatial data. And that framework really has been extremely beneficial, because we are working with schools, we are working with professionals in healthcare to collect the data and to visualize, the outcome. And I'm going to share with you on the next slide what we got in Kenya. So if you go back to the access to water, as you all mentioned, water is extremely critical because people have to wash their hands. Interesting enough, this is a very good foundation for driving policy. As you can see, out of around, I think we had like 480 water points, 0% is operated by the government. So you realize the government wants to protect people, but there's no means to really rely on the government to do so. So now you're exposing some of the weaknesses and present opportunities for local officials to say, what can we do to better protect people when such a pandemic comes around again? The second thing that you also see is the role of the privately owned water point. So maybe the idea might end up being, let's help most of the private owned water point as well the NGO, because they seem to have a better access to local population and the better access to provide the water. So this is really the type of thing that we start uncovering as we look at the data and to be able to make decisions. And the last point that I want to make is on the next slide. So we collected a lot of data. If you take a step back when COVID-19 started, the biggest challenge we had was ICU beds, for example, in the US, and the same in Africa. So how does a city mayor understand the capacity, the medical capacity of his city? As you look at healthcare, how many doctors do I have? How many male doctors? How many female? How many nurses? How many bed do I have? And when you look at bed, ICU bed with oxygen, and so on and so forth. So the whole idea was, how do we collect data and present that information to local officials so they can drive decision and improve the impact of, improve the mitigation of second order impact. You can also see the whole notion of diagnostic. In these cases, we try to collect, I think that was paid by, I forgot which city that is, where do I go if I need some tests? How do I get the care that I need? That is the key point. So if I can summarize what we really did, it's working with the local community, gather the data, frame it in a way where we can present it and drive decision, either for water access or to healthcare access, and also really understand the impact on local population. So we'll be sharing more about the methodology and the tools we use on Friday, and I hope you guys will be able to join and attend that presentation. Thank you so much, Laura.
Oh, thank you so much, Dr. Mbonglou. What a great presentation and a great set of kind of initial outcomes from your projects there. I wanted to put one question your way, and I don't see any open questions for you at the moment in the Q&A, but you speak about the importance of connecting with the local community and the importance of connecting and bringing these answers to the local mayors and decision makers. How have you found, how has it been in setting up partnerships between your teams and the local communities or the local mayors? Do you find them receptive? Do you have any tips or suggestions you'd like to share perhaps with our audience and others who might be interested in setting up such collaborations, or as to use Nama's words, to connect science to society, as you showed some great examples of today?
Yes, that's a very good question. One of the things that we have done is really team up with university, because we believe university are a very good channel to the local official and the local population. So working with university as an anchor in every single city, or with some of the NGO that have proven to be able to work with the community, it was easier to connect to the leadership in the city. And interesting enough, the leadership made it very easy for us either to access the different schools, because during the time of pandemic, it's very hard to go out and collect data. So they facilitated a lot of those discussions because they saw the value. It's all about protecting their people. It's all about having the information they didn't have before to make the right decision. So the connection with university, the connection with civil society, and connection with NGO that have been on the ground for years, and I'll take the example of Kenya with the mapgive project has made it extremely critical in the success of what we've done.
That's outstanding, and that's great to hear that organizations were so receptive. And for geographers, you've gotten over the first hurdle of explaining and getting people to understand kind of the value, which sometimes I think we spend so much of our time trying to explain our data and then how it can be used and how it can help. We do have a few minutes left for question and answer for across our whole panel. I want to bring it back, as I said it would, to Elman's question. And Robbie, we'll start with you, and Gaston and Fik, I think both of you could also have answers to this as well. But Robbie, if you'd kick us off. Elman's question was regarding your recommendations at the end of your presentation for social protection. And he was asking, how would this work in low and middle income countries? If you had any examples or suggestions on what you've seen out of your research.
Yeah, so I have thoughts about that question, but the answers are not simple. As one of the persons in the Q&A pointed out, many low and middle income countries are already saddled with great levels of debt. And they're also lower income countries by definition. And yet the social safety net programs are the kinds of things that need to be built into economies in advance of an economic shock like COVID. My best suggestion for this kind of program would be to develop social safety net programs that can be shared regionally. For example, through regional institutions like the African Development Bank, the Inter-American Development Bank, the Asian Development Bank, which has sort of continent-wide responsibilities for financial matters. Those kinds of institutions are probably best positioned to handle regional risks where the cost can be shared among countries rather than every country. Where social safety net programs are available, they're often for the employed who pay into unemployment insurance. So for those who are self-employed or in the informal economy, they don't have access to the very programs that would benefit them most.
Thank you, Robbie. Gaston, would you have any suggestions?
Yeah, I mean, to extend to Robbie's point, I'll look more on the social side. One of the things that we find out, because they don't have the financial means to really create a social net, it's really about sharing best practices. And one of the reasons we went to Bukavu is because if you go back to Ebola, Bukavu was one of the center of the Ebola disease. So being able to learn how they use that experience to protect their people, what strategy did they use to reduce the impact on the local population was an extremely important point in the strategy we use. So short of having the financial means, how do you leverage best practices that you can share with other countries and other cities?
Oh, thank you. Yeah, I mean, both topics, I mean, you're speaking to trying to build resilience ahead of time and sustainability for these countries and taking the best practices and lessons learned from previous similar events, which was a key talking point from yesterday's sessions as well. Fik, if you're still with us, do you want to offer some thoughts on the sort of social protections that might be of most use for your survey participants in Hong Kong, or perhaps for other groups of informal workers, domestic workers elsewhere, and best practices to share?
Yes, can you still hear me?
Yes,
I'm nervous with Zoom today. It's just some issue. Yeah, so it's in terms of like social protection, my knowledge is limited on this, but I can speak on, I just read the Hong Kong government website that actually they, of course, like Hong Kong economy going down because of the COVID, like they closed a lot of, especially their airline industry. But like in terms of domestic worker employment, they didn't reduce the salary. So that's actually huge for domestic worker, because some of them were afraid, even like some my research participant, they were afraid if the Hong Kong government will sort of like lower down their income, sort of like cut, because they have like the standard like the minimum wage for domestic worker in Hong Kong. So they were afraid if the government will decrease that value, that money. So I read from the website and they didn't reduce that. So I'm actually thankful. I mean, like personally, I'm thankful that the government still helped to sort of like help the economy, and then for the domestic worker, they didn't reduce it, and it's really helpful. And also there were also some issue that both from domestic worker side and then from the employer side, because employer need domestic worker, right? So they were like afraid if the COVID and then nobody can come to Hong Kong because border closed, but domestic worker can actually still come. Like for instance, myself, I couldn't go to Hong Kong, but domestic workers still come, and then they quarantine and they follow all this the policy. So that needs actually still can fill up. And yeah, I think that's what I can speak. But in terms of like the social protection itself, my knowledge is very limited on that. Thank you, Laura.
That's great. Thank you. Well, and something you spoke about, and Gaston spoke to this as well, where the government policies and how impactful that was upon social order impacts for the group that you were looking at. Was there anything, I guess, besides what you just mentioned with regards to the no changes in salaries, was there anything that the government policy or impacts that came out of government policies that you wanted to highlight, or that you think was a key lesson learned for other countries to consider? And Gaston, I'll probably ask you the same question.
Yes, so especially these two, not two, but Indonesia and the Philippines, that's actually two countries that send a lot of domestic workers to Hong Kong in particular. Their government, I would say, quote unquote, fight for domestic workers. So if there is like some policy change during the COVID, they try to fight, like they try to help, they try to like protect domestic worker, their domestic worker. I mean, like Indonesian government through the Consulate General in Hong Kong, and also Filipino. So I follow like that if there is anything, little thing change from Hong Kong perspective due to COVID, like the impact of COVID, because like the government changed over the time, like during the COVID, like from last year, from January, February last year to now, it changed. So the Filipino and Indonesian government, they always react in terms of for the best interest of female domestic worker.
Wow. And well, thank you for that mention. And I didn't even think about that direction, and how the local is really influencing the larger regional, national scale. Gaston, we have just a minute or two left, but do you have any thoughts on these, the government impacts? I mean, you mentioned the vicious cycle, but anything you'd like to share, and even, expanding it out to the regional scale, which, as I mentioned earlier, we'll discuss across multiple scales today.
Yeah, I mean, one of the things that a lot of government had to deal with is the local culture. As you look at a lot of countries in Africa, it's really about family getting together, enjoying, being social, and all of a sudden you're confined to your home. So very often you will see a pattern in some of the measures that were taken to relax the economy. Either they might relax how many people can go to church. For example, sport, that is something that gets people engaged. So they were really accounting for the social impact of the measure they were putting together in addition to the economy. How do you balance those different things? That was something that was visible across all the different countries that we look at.
That's great. And thank you so much for sharing that with us. Mel and Jungwon, I think we have just a couple minutes left before we're going to go to our coffee break for today, but allow me to offer most gracious thank you to all of our panelists today, Dr. Richardson, Dr. Mbonglou, Ms. Winata. What a great set of insights you've shared with us today. You've really illuminated some of these themes and trends that we've seen running throughout the sessions so far, and really appreciate your contributions. Thank you so much. And thank you all for all of your great questions. Please keep them coming in the Q&A. This is really great to see the dialogue going, and I hope our panelists will stick with us to continue to answer questions. Melinda?
Yeah, thanks so much. We'll segue into our coffee break now. We scheduled this time so people could stand up from their desks wherever they might be, get a cup of coffee, get a glass of water, whatever, take a short break. We'll be back at 10 minutes after the hour, wherever you might be, and we'll start again with our lightning talks. I know there are still questions that are in the chat as well as in the Q&A, and we'll continue to work through those. And I just want to comment on the provocative questions that Mohammed is raising here, speaking to these issues of inequality, inequity around the world. How do we start to really address those, the divide between rich and poor? These are all very important things. And so keeping those in mind, we will not forget them. So with that, we take a short break. And again, thanks for the rich discussion this morning and the excellent set of presentations.
Hello, everyone. I'm Laura Klein from the State Department, from our Cities COVID Mitigation Mapping program. And I believe we are ready to go ahead and get started with our lightning talks. Mel, do you have any, Mel or Jungwon, do you have any remarks as we get started, or should we start right in?
It's fine to start right in, Laura. Thanks so much.
Thank you. Well, thank you to everyone. Hope you had a nice, quick, refreshing break. We have quite a lineup for you here for the second half of our symposium here today. We are going to continue along examining the second order impacts as they are at the current status and as we've been researching for the past many months, almost a year now with our projects here. This is a great opportunity to learn about work that's going on at the local level. These are lightning talks, short talks, recorded videos, which have been created by our Cities COVID Mitigation Mapping, C2M2, partner projects at the local level. So we are going to hear from these 4 teams across the globe. They are part of each of the 3 regional hubs are represented here. The Latin America, Africa, and Asia hub are represented here. They're going to share the experiences and perspectives of the COVID-19 pandemic as they've experienced them here over the past year. We're going to start off with Nairobi, Kenya, and looking at some of the vulnerable communities and the informal neighborhoods within Nairobi. The title for this presentation is The Second Order Impacts of COVID-19 on the Economy. And this presentation has been created by Erica Hagen from the Ground Truth Initiative, the lead for our C2M2 project in Nairobi. With that, Jungwon, are we ready?
Yes, I'm now opening the video.
Perfect.
Hi, my name is Erica Hagen, and I am a director of Ground Truth Initiative, which is working in Nairobi, Kenya on the C2M2 project with partner mapgive Trust based in Nairobi. So as far as COVID in Kenya and Nairobi, there have been around 75,000 cases of COVID in Nairobi city, with 2 major periods of lockdown, which included restrictions on travel and gatherings, and have impacted the economy pretty severely. One of those periods being early in the pandemic last year, and another period starting around January of this year, when there was a major spike in increasing cases in Kenya. Nairobi has definitely been the epicenter of the pandemic in Kenya. mapgive Trust works primarily in Kibera, an informal settlement, which is around 250,000 people in population in Nairobi, and also in other slum settlements, including Mathare. So this project engaged both of those settlements. One of the topics we explored as terms of second order was water. There was a water shortage that hit Nairobi just as messaging was coming out around the importance of hand washing and sanitizing for COVID. So although many organizations stepped up to create different hand wash points in the settlements and things like that, there was still a major problem acquiring enough water for home use. I will play this video by Kibera News Network, which let me just share the screen, which highlights a bit about the water problem that we addressed or that we mapped.
Availability or lack of water in the slum has had different impact in the spread of COVID-19.
Time corona ilikuwa ngumu kupata maji cause unapata time au kubali kutoka nje kwenda faa na maji pia iko karibu.
Water is an essential commodity and one that has been vital in the fight against corona pandemic.
Kukosekana kwa maji ilichangia pakubwa sana kwa watu kupata corona. Cause unapata wase wengi walikuwa na hiyo haja kuosha mikono, lakini sasa kuna maji.
In Mathare and Kibra slums, residents had to stand the water dry spell that followed soon after the announcement of safety guidelines from the Ministry of Health. during the COVID-19 pandemic, there's scarcity of water. Watuomo twanyiewo gi pesa. To samoro pigno jiriede en pi achiel joma tuchwako kogo dware wan bende wariedo ne seche moko chopo manyaka jigore pigni. There was a scare of corona spreading within the slums of Kibra and Madare if the water shortage was not addressed in time.
We don't have the finances and the water is scarce. Yet the rules are saying that you have to wash your hands every day.
Samoro pio lal, skech onyalo lal kata week mangima. Kuro ma in ge ot mathin no, ok inyal logo maler, gik moko ok nyal dhi maber. How have the residents been dealing with the water challenge?
NMS kutoka mwaka jana wamekuwa kipaumbele sana kwa kusaidia watu wa Kibra na maji sana sana katika janga hili la corona.
Mapping of water points both in Kibra and Madare exposed several issues that the community had to deal with while trying to access water. We were mapping all the water points within the various communities that we went to, that is Kibera and Madare. There are so many cartels around water. If you have like enough supply of water in your area, they are the ones who like take charge.
Kuna wale makatels ambao wanaenda wakikata maji, wao wanajinufaisha na watu wengine wanaumia.
Time yenye tulienda tukalilia chief tukamwambia hatuna maji, tuliona pipe ya maji ililetwa na maji ikaanza tukaconnectiwa maji ikaanza kuingia.
Yeah, so as you can see, there's quite a number of interconnected issues around water, which have been exacerbated by the pandemic. We also did a survey. We surveyed 660 residents and random sample in both settlements about their water uses and challenges. We had 80% saying that they needed more water than usual, 62% saying that they had faced difficulty accessing enough water during the pandemic, and that included both trouble paying for the water and locating a real source. So this showed that while, as you saw, the Nairobi Metropolitan Services did provide some free water, it was not widespread enough. 75% of residents said that they had not accessed the Metropolitan Services free water program. So let's take a look at a couple of maps. Let me share the screen. So this is Nairobi, and the base map is OpenStreetMap, where all of the data that you see here is located. And down here is Kibera. We zoom in a bit. So right now it looks like, okay, so if we turn on and off some of these toggle buttons, you can see that, if we click on sometimes, a lot of the water points show up because the majority of them are going to be visible or available sometimes. But if we, let's see, we can also look at fee. If we want to take out and show those that we know have no fee, it reduces quite a bit. And if we take out the operational status, take out non-operational, take out those that never have any water or only sometimes. So we're left with quite a few. And there's a couple in here that might be undefined or they couldn't find the answer. So actually the access to any sort of free water point is quite minimal. If we go further and look into the operator type, these are all kinds of operators. Most of them are going to be private. If we look at the Nairobi Metropolitan Services mentioned, and we're looking again at only the operational with no fee, again, it's reduced quite a bit. And then we add fee back in, we might get a few that are actually charging fees, even though it's a Metropolitan Services water is meant to be free. The cartels that were mentioned, there's often local people that kind of take charge of water and sell it. So again, this is Mathare. We'll add back in sometimes, we can add back in private. You can see that there's quite a few private operators. NGOs International, this is a local community fund, religious community. So there's just kind of a few others, but most are private that you'll find. So I think that, you know, basically what we're seeing is there's a need for placing important resources that are free and accessible, especially during the pandemic, to prevent disease. Thank you very much.
Thank you, Erica Hagen, for your great presentation there. This was a good example of kind of the storytelling and really trying to better understand one of these second order impacts that we see, but also then, as Gaston spoke to earlier, about defining your question well and understanding what data sets can best be most helpful in answering this question. And so she showed us some of the open and available data that they've created to better understand this critical issue in their city. We're going to move on to the next C2M2 project. It's our Dhaka, Bangladesh project. The presentation is by Tausif Bakibila from the Bangladesh Open Innovation Lab, BOIL, an NGO whom we're working with in Dhaka. And the presentation is titled A Displaced City, an Aftermath and Impact of COVID-19 on Livelihoods in Dhaka. So whenever you're ready, Jungwon, thank you.
Meet Farida Begum, a 60-year-old widow from Mirpur, Dhaka, Bangladesh. Since the pandemic hit, she has faced job loss, salary cut, and other newly emerged livelihood problems, which made it very difficult for her to sustain in a costly city like Dhaka. Our project, A Displaced City, Impact of COVID-19 on Livelihood, focuses on people like Farida Begum, who is facing the severe secondary impact of COVID-19. We, the Bangladesh Open Innovation Lab team, welcome you all to the lightning talk of C2M2 project in Dhaka. In this project, we are trying to assess the secondary impact of COVID-19 on the low-income communities while focusing on possible internal migration scenario of Bangladesh. The outcome of the project will mainly be geospatial analytics, which will not only create an enriched GIS database for better policymaking scenario, but also will provide a platform to engage the relevant stakeholders who can help to mitigate the problems. Our scope focused on generating research-based socioeconomic vulnerability data while exploring the connection of outbound migration of affected population from main cities of Bangladesh. Complying with our research goals, we are creating geospatial datasets that explores and identifies the data gaps in managing COVID-19 induced crisis while providing new insights for mitigation. Our data collection and collation, which has been going on for a long while, has multiple steps which are desk review, focus group discussion, socioeconomic household survey, vacant household survey, key informant business survey, key informant interview, and so on. So far, we have surveyed almost 6,000 households, more than 60 business key informant interviews, and focus group discussions containing more than 50 people altogether. These datasets will be combined with the secondary datasets of our research repository and analyzed geospatially. Now, we are going to share some of our key preliminary findings with all of you. The gender ratio of our respondents is almost equal. We try to find out the profession of the demographics to determine the occupation variation. Our questionnaire also explored the pre-COVID permanent residence of the respondents to assess their migration origin. This will give us the base to compare the pre-COVID migration scenario with the changes that occurred since the pandemic started. We also explored the economic status of our respondents. There were several secondary impacts of job loss, salary cut, and sales decrease during the lockdown phases. The income datasets also showed similar trends where monthly income significantly reduced during COVID-19 lockdown periods, which resulted in impacts on other livelihood parameters, such as inability to pay rents, afford health services and food commodities, pay loans, and deterioration of mental health eventually. 32.6% of our respondents had to withdraw themselves or their children from school because they could not afford the expenditure. These datasets lead to the scenario of internal migration in the study area, where we explored the reasons behind residents of the study area migrating to other places of Bangladesh. The answers oriented around lockdown, financial reasons, job loss, and food security. The respondents were also asked if they got any support to mitigate these problems, but majority of them said no for this. We tried to geospatially show the migration scenario of Bangladesh through these maps. While the health map provides a base for our analysis, the secondary and primary data map demonstrates the vulnerable areas of Bangladesh where the people migrated to from the capital Dhaka and our study area. So what's next for our project? In this next phase, we will try to do the relational analysis of the parameters to know more in depth about the cause and effects. We will also do qualitative or descriptive analysis of the datasets to draw an overall scenario while telling the story of the low-income communities. Our final report will consist all our analytical findings from both qualitative and quantitative data. Finally, we will work on report and product dissemination with stakeholder engagement to raise awareness and expedite mitigatory policies and actions. If you have any queries, suggestions, or comments on our project, please do send us an email on ask.put@gmail.com. Finally, we would like to thank mapgive initiative and the Office of Geographers to let us be a part of this global C2M2 project. We also thank earnestly AAG and C2M2 Asia Hub for the constant support and guidance. We eagerly look forward to share our final research results with all of you. Thank you so much for listening to this lightning talk. Stay safe, stay resilient.
Thank you so much to the Boyle organization for your presentation here. What a great description of what's going on in Dhaka. You really highlighted that interconnectivity that we were talking about earlier, where while we have these themes broken out into 3 separate days, mobility and migration, livelihoods today, and gender tomorrow, there really is such a tightly woven interconnection between these factors and many more with these second order impacts as we're trying to research them, and really requires this multidisciplinary focus and a wide variety of tools to better understand and really the value of these partnerships. So thank you so much for your presentation on Dhaka. We're going to move on to our third presentation. We have a presentation from Ungtung Galag Chunglungatar out of our Public Lab Mongolia partner that runs the C2M2 Ulaanbaatar project. This is titled The Case of Health and Essential Services in Mongolia's Capital Amid the COVID-19 Pandemic. Thank you.
Hello, everyone. My name is Ungtung Galag Ulaanbaatar, and I'm a co-founder of Public Lab Mongolia. We're part of the C2M2 Asia Hub, Cities COVID Mitigation and Mapping. Today, I'll be talking about the C2M2 Ulaanbaatar project in Mongolia. The Ulaanbaatar project goals include improving open data on Ulaanbaatar through OpenStreetMap, conducting vulnerability analysis of settlements in Ulaanbaatar, and finally, developing health service information portal, which you can learn more about on the last day of the symposium on the 25th, where I will present along with colleagues from Kathmandu Living Labs. Let's begin with learning more about the city of Ulaanbaatar for the context of the C2M2 project. The capital city of Mongolia, Ulaanbaatar, is home to about half of the country's population of 1.5 million people. It should be noted that the city was initially designed for 500,000 people. The city expands as rapid urbanization and extreme climate events draw more people from rural areas into the city for education, jobs, family, and better opportunities. The city is divided into 2 main settlement areas, including apartment and gear areas. The access to essential public services is not equal across the city. Over 60% of the city's residents live in gear areas, which is unplanned settlements without connection to infrastructure such as heating, water, and sewage systems. Air pollution is a public health crisis, making Ulaanbaatar the most polluted city in the world during winter months, owing largely due to coal burning in frigid temperatures. The toxic air has been undermining the health of the population with a burden of respiratory illnesses, which makes the vulnerable even more susceptible to the impact of the COVID-19 virus. The gear areas are divided generally into 3 zones: central, mid, and fringe. As you might imagine, the central gear area tend to be the oldest part of the city, with long-term residents and more permanent structures. Mid-gear area is a mix of older and newer settlements. Fringe gear area tend to have mostly new urban migrants and are furthest from infrastructure and services. Within the C2M2 project, we're working to mitigate the secondary impact of COVID-19 on health service access in Mongolia. The scale of the pandemic in the country has had an overwhelming burden on existing health services. As the number of cases and the need for hospitalization for COVID-19 patients increase, other essential health services such as emergency, pediatrics, oncology, and so on become more limited.
Сайн байна уу, намайг Алтнаар гэдэг. Одоо 21 настай Улаанбаатар хоттой хангахын шинжлэх ухааны үндэсний сургуулийн 5 дугаар курсын оюутан байна. За, эрүүл мэндийн үйлчлэгийн талаарх мэдээллийг олцоход бол маш хүндрэлтэй. Яг гэвэл мэдээллийн нэгдсэн сан гэж бол Монголд байдаггүй. Тийм болохоор маш олон бэрхшээлүүдэд тулгардаг. За, нийт гэвэл ойжир дараалал маш хүсдэг. Ялангуяа 2 дугаар шатлалын эмнэлэгтэй. 2-д гэх юм бол гэртээр газар заавал хол газар очиж үзүүлэх шаардлагатай болдог. 3-д гэвэл мэдээлэл байхгүй болохоор тухайн газар очиж нөгөө нэг үйлчлэгнийхэн талаарх мэдээлэлт нь бол таньсан шаардлагатай болдог. 4-д гэвэл олж чад хэцүү газар байх юм бол нөгөө нэг цаг хугацаа их алддаг. 5-д гэх юм бол цаг авч үзүүлэхэд нөгөө нэг тухайн үйлчлэгний байгууллагын усны дугаар ч юм уу мэдээлэл байхгүй болоод цаг авч үзүүлэхэд бол хүндрэлтэй байдаг. Тийм болохоор нөгөө нэг эрүүл мэндийн үйлчлэгний мэдээллийн сан байх нь бол маш чухал гэж бол би бодож байна.
According to a World Bank report in 2021, 1 in 3 people could not access health services they needed due to lockdown, limited access, and fear of contracting the virus. Now, let's look at the COVID-19 situation in Mongolia. Until mid-November of 2020, Mongolia had no reported community outbreak of COVID-19 cases, thanks to swift and strict measures to close its borders, suspend local travel, and other lockdown measures. WHO and other international media praised and exemplified Mongolia's efforts in containing the COVID-19 virus. Today, about exactly 7 months later, Mongolia is grappling with one of the highest infection rates per million people globally. The impact of the pandemic has been numerous, as has been in other countries, including economy, education, healthcare, and so on. During this period, politically, we saw resignation of the entire government and turnover of the health minister, head of special committee to combat COVID-19, and more recently, the president. This is a causal loop diagram that aims to explain the impact of the pandemic. In the middle here, we have lockdown duration and severity tied with the number of COVID-19 cases, both of which kickstart the chain of impact among the population. We observe that governance and political instability play a significant role in the level of impact the pandemic has. Here we have the economic section dealing with financial impacts of COVID with income loss, increasing prices of staple food and products, and debt. The financial insecurity coupled with existing poor living conditions and limited access to services lead to more factors of vulnerability. For example, due to the travel or transport restrictions, in the gear areas, getting to essential services to get food, medicine, or medical services have become exacerbated.
Явах гэсэн ч ерөөсөө ингээд өглөө ингээд залхаад хүргээ явна гээд хүргээ явчих хүргэж өгнө гээд залхахаар ерөөсөө ирэхгүй. Тэгээд ингээд өглөө наанаас чи ингээд машин явж байгаа. Одоо энэ ажиллаж байгаа 15 байгууллагын юунд хамрагдсан ингээд автобуснууд явж байгаа гэдэг гисэн. Тэгээд ерөөсөө ирээгүй. Тэгээд айгүй худаа автобус хүлээхээр ерөөсөө автобус нь тэгээ ирэхгүй ерөөсөө айгүй их даарч ингээд хүүхдээ амар даарад амар хэцүү байна. Тийм. Хүүхдээ заавал эмнэлэгт үзүүлэх өснө үү, цагтаа өснө үү, яг юу нэмлэг заах вэ? Тийм, цагтаа шинжилгээ өгөх хэрэгтэйс ерөөсөн ингээд би хаана хүүхдүүд аюу хэцүү байгаа шүү дээ. Тэг хэцүү ах чи ерөөсөн ингээд цагдаа нарт учирлаж хилээд ерөөсөө ойлгохгүй байна. Тийм. Энэ гараа явах гэж оролцсон. Тийм, явах гэж оролцсон чи ерөөсөө гарахгүй байна шээ. Уул ингээд бичиг байгаахгүй. Тэг бичгээ харуулаад явах гэсэн чи ерөөсөө явуулахгүй. Тэг одоо та яаж эмнэлэг рүү яв? Одоо харин алхах тийм үү? Ерөөсөө өнөө алдахгүй шүү дээ.
This brings us to the discussion of initial results of the vulnerability analysis. The vulnerability analysis is developed based on government data on different public services as seen in this table. We choose to work with government data that are likely to be updated annually. The method we're using to develop the vulnerability analysis is level of service access for residents across the city. As shown in this table, we have 5 levels of service access. First level is based on service access standard set by the government, Article 5.4 of Urban Planning and Construction Regulation Norm. This is usually 300 to 500 meters. The subsequent 4 levels, double, triple, quadruple, and quintuple the standard service access radius. Here we look at some initial results of geographic analysis illustrated in thematic maps. First, access to health services. You can see the access levels differentiated in colors from dark green being within standard service access to red being 5 times further than the service standard access. As you can see, the green zones are mostly within the apartment areas, which is marked with black outline. Next is access to food sources, including grocery stores and markets. You can see that the green areas become much bigger than health services. This means there is wider distribution of grocery stores and markets than health services. However, the fringe areas still remain largely orange or red. Then we look at wash services, which include water kiosks and public bathhouses. You may notice there's a lot of red in the apartment areas. This is because there is no water kiosks or public bathhouses where there are apartments with modern commodities. A lot of the fringe gear areas are located on hillsides and harder to access geographic locations, where water kiosks are not built due to being far from central water pipes, too deep to drill into the ground. Next, we look at transportation and mobility thematic map. As you might notice, the green level service access is much bigger than the previous 3 thematic maps. This is good, so that people can access public transportation more easily in the gear areas. But we still see some of the fringe areas in red where access is very limited. Finally, we look at thematic map analysis for educational services. These include public schools and kindergartens. Again, a similar trend of dark green in apartment areas with good access, and central gear area in yellow, while mid and fringe gear areas are in orange and mostly red. As I mentioned before, these maps are initial results of our vulnerability analysis, and we continue to develop more geospatial analysis such as composite mapping, where all the thematic service access maps are combined to see which areas have the highest level or risk of vulnerability. This is the end of my lightning talk today. If you would like to learn more about Public Lab Mongolia or get in touch about C2M2 Ulaanbaatar project, here's our website and other contact information. Thank you for your attention.
Thank you so much, Public Lab Mongolia. What a great presentation. They showed off one of our tools and techniques that we're using in the C2M2 program, the causal loop diagram, which Dr. Richardson has shared with us across our teams, has been very helpful in understanding this and really illuminated some of these the interconnectivity of so many of these different second order impacts that we're talking about, and the ones we aren't even addressing here at the symposium, such as health and how all of this is impacting their vulnerable communities. Our fourth and final lightning talk, and a great example again for you of work that's being done at the local level to understand these impacts, is from Dr. Laura Orellana out of the Universidad Peruana Cayetano Heredia from Lima, Peru, our C2M2 Lima project there. The title is Domestic Violence During the COVID-19 Pandemic in Lima, Peru.
Good morning, everyone. My name is Laura Orellana. In this opportunity, I'm going to present the impact of the COVID-19 pandemic on domestic violence in the metropolitan Lima City, Peru. Well, according to the World Health Organization, domestic violence is any act of gender-based violence that results in physical, sexual, or mental harm or suffering to women, right? So we will feel complaints of this type, in addition to the complaints of patrimonial violence that also happens at home. In Peru, according to the National Institute of Statistics and Informatics, Metropolitan Lima City is the city with the highest number of complaints of domestic violence. So in this context, in 2017, the Ministry of Women and Vulnerable Populations launched the national program for the prevention and eradication of violence against women and family members. This program is called Aurora, whose purpose is to design and implement nationwide actions and policies of care, prevention, and support to people involved in acts of family and sexual violence. This program is made up of 3 main centers, the Women Emergency Centers, the Institutional Service Centers, and Urgency Services. So in this picture, we try to compare the number of domestic violence complaints made in 2019 and 2020. In Peru, the lockdown began on March 16, so we observed that from that date, the number of complaints decreased until June, when more flexible restrictions measures were taken in Peru. According to previous studies and the World Health Organizations, cases of domestic violence increased during periods of national emergency, such as the COVID-19 pandemic. However, in the case of Lima, it was the opposite, right? Which leads us to think of alternative explanations, such as a limited access to Aurora services during the lockdown, or perhaps the lack of an alternative plan on the part of the program in the event of a state of emergency. So of course, let's keep in mind that COVID-19 was a surprise for everybody. In the following maps that I'm going to present, each circle will represent the location of the Aurora Center. They will have a color proportional to the number of complaints made. The red and the blue circles are going to be those with the highest concentrations of complaints. In this slide, we will observe a base map that has a color intensity proportional to the number of domestic violence cases reported in 2019. And the circles will represent the reports in 2020. As I mentioned, the red and the blue circles are the centers with the highest number of reports. So a comparison shows that for both years, the districts with the highest number of complaints are Cercado de Lima, San Luis, and Barranco, and Lurin. They will have a complaints rate from 45 to 127 per 10,000 women approximately. In this slide, the base map are colored in proportion to the Human Development Index. The first map refers to the period of lockdown from March to June, and the second to the post-lockdown period from July to December. In both cases, we observe that the centers with the highest concentrations of complaints are located in districts with a slightly higher Human Development Index, with a 0.7 on average. Visually, we could think of a correlation between the two variables, so we proceed to perform a statistical correlation test. We perform a Spearman correlation, in which we obtain a low coefficient of minus 0.24. So the correlation is really weak. In this case, the base map are colored in proportion to the COVID-19 mortality rate. Again, the first map refers to the lockdown and the second map to the post-lockdown. In both cases, we can see that the center are with the highest concentration of complaints are located in the district with the highest COVID-19 mortality rate, which range goes from 50 to 90 cases per 10,000 people approximately. Also, we proceed to perform a Spearman correlation in which we also obtain a low coefficient of 0.27, which means that is a correlation weak. The correlation is weak. So I hope you like the presentation. This is the work team. Thank you very much.
Thank you very much to our team in Lima, Peru, and all of our C2M2 project teams that we've been able to hear from today. This kind of wraps up the portion of our symposium where we're talking about the nature of second order impacts as they are on the ground. I think our keynote coming up here will speak a little bit to that with regards to the African continent, but he also has many thoughts to share with us with regards to the future and potential opportunities in going forward. And we have a surprise guest to jump back on to provide some introductory remarks. Mel, do we know if he's connected?
Yeah, we're just working now to make sure that he has co-host responsibilities. Wendy, have you been able to do that so Lee will be able to speak and be on the video? He's an attendee right now.
I was pleased to be able to know that we have Dr. Francis Koti here with us today. I will at least read his title. He's a professor of global studies and human geography at Middle Tennessee State University in Murfreesboro, Tennessee. He's an urban geographer, woohoo! And Dr. Koti holds a PhD in geography from West Virginia University and Morgantown, West Virginia. However, boss's privilege, my boss, upon seeing his name on the list of speakers for our symposium here, let me know that he's actually an old friend. And so Dr. Lee Schwartz wanted to come back and provide a bit of a personal introduction for Dr. Koti here today. How are we doing?
You've got me now.
We've got you now. Oh, hi, Lee.
Just in the nick of time.
Take it away.
Okay. Well, good day, good morning, good afternoon, good evening. We have people from all over the world, so I think I've got all bases covered. And as Laura mentioned, I'm very pleased to have the honor to introduce, excuse me, Dr. Francis Koti as today's keynote speaker. Not only because of my respect for his work and his leadership in the field, but also because, as Laura mentioned, I've been friends with Francis ever since we first met when my office invited him to participate in our Global Dialogues for Emerging Science and Technology Symposium in Cape Town, South Africa, back in 2008. I guess that was when GIS could still be considered an emerging science and technology, and also back when you could have in-person meetings to discuss future applications and collaborations. And the theme of that meeting was geospatial science for sustainable development in Africa. And it was founded on the concept of mapping Africa for Africa. And that is still fundamental to our participatory and inclusive approach to tap into local expertise, to fill in knowledge gaps in mapping the human geography of urban areas around the world today. And you'll soon see that our keynote speaker exemplifies those values. Dr. Koti is Professor of Global Studies and Human Geography at Middle Tennessee State University. He's an urban geographer by training and earned his PhD from West Virginia University. His research revolved around the use of geographic information systems within participatory and methodological frameworks to understand urbanization processes with a regional focus on Africa. Francis has worked in several capacities to promote the inclusion and collaboration of diaspora African scholars and scientists. And I know a few people who have worked harder to make our academic discipline more interactive and participatory. In addition to serving most recently as chair of the Department of Geography at Middle Tennessee State, Francis has previously held administrative and leadership positions as interim associate dean and department chair at the University of North Alabama, secretary of the Southeast Division of the American Association of Geographers, and guest editor of a special edition of the journal Africa Today. I know of no scholar whose research on African cities more effectively straddles the worlds of academic and applied geography, in particular his studies of peri-urban development, urban and regional planning, local community resource use and access, and social and spatial exclusion in African cities. Francis has for years been at the forefront of work related to participatory GIS. He is perfectly suited to provide today's keynote talk on the theme of livelihoods that is so critical to raising the human condition in many of the world's urban communities, where inequities abound and there are stark differences between the served and the underserved. More importantly, however, knowing Francis means you can't help but be impressed by his passion, his concern for humanity, and his desire to understand more about how neighbors and neighborhoods can better sustain themselves, not just in his native Kenya or in Africa, but in underserved communities worldwide, including in the United States. So Francis, welcome to our virtual symposium, and I thank you in advance for sharing some pearls of your wisdom with us today. I'm sure we will enjoy what you have to say. Over to you. It's good to see you, my friend.
Thank you very much, Lee. I'm going to go ahead and share my screen here. And allow me first to thank Lee personally for working with me and mentoring me in various ways over the years since 2009 when I met him through today, either through my academic work or my work as an academic leader here in the United States and also back where I come from in Kenya. I also wish to thank organizers of C2M2 Symposium for inviting me to this session. Is really tremendous honor. And particularly, I would like to thank Yuan for corresponding quite effectively and efficiently to make this work in the past few weeks. My talk today is Resilience Amid Uncertainty, COVID-19 Pandemic and Informal Sector and Livelihoods in African Cities. And really, it stems from my interest and passion in understanding place, understanding how we interact with each other, how we interact with the built environment, and how people in what Laura earlier called suburban scale access resources and programs and services. And so what you're going to hear here is not necessarily linked to just the past few years, but to over 20 years of work, looking at how expert and non-expert systems can communicate. And that is where I'm coming from. And so in the next 20 minutes, I will try to frame the informal sector and urban livelihoods within a broader context, and then make some observations on perceived resilience and expansion of the of the informal sector amid COVID-19, and reframe the conversation to try to ask new questions, and then try and see if I can identify some areas where people can collaborate. And since I've been working in Kenya in the past few years, I will use Kenya as an example. Here is a summary of what I think I will try to capture. That post-pandemic informal sector is probably going to look like it's expanding, but it will be more sophisticated than we think. Because one, folks that are falling out of the formal sector are coming into the informal sector with new skills, will introduce new activities, and will probably exacerbate an already differentiated landscape. There is a perceived resilience of and expansion of the informal sector, and there's a chance that could conceal inherent inequalities, and that could create a simultaneous empowerment and marginalization of a section of the informal sector. And one of the observations I'm also making is that the second order impacts will not be experienced the same or in a uniform manner across multiple scales, across social and economic scales. And how to mitigate this is probably going to require a better understanding, and there's no better way to do that than to connect local narratives and data points in order to understand the landscape, and a more integrative approach, more multi-scale, multi-stakeholder approach that recognizes those differences, I think will be critical. Those are the arguments I'll be making here. And when I became interested in this topic, I started looking at what is written in popular press about the informal sector. And much of that seemed to paint a grim picture of what is likely to happen to a sector that potentially employs over 80% of urban populations. And I became concerned because previously I'd been looking at issues of access to water, which is what Gaston mentioned earlier, is what they are working in Nairobi. And so based on surveys of what has been written about the informal sector, I will not bog you down with the literature and theories, but there seems to be a conceptualization that pulls together three related concepts. Something about employment and production in an unregulated, unregistered small businesses, and informal employment with no social protections, and as we've heard earlier from Robert Richardson, and the informal economy, which has elements of what I just mentioned earlier, 1 and 2. And regardless of what the definitions are or what the conceptualizations are, clearly the informal sector in urban settings is a key economic force. And it embraces quite a diversity in terms of the people, in terms of the activities, and in terms of the character of the sector itself. There's quite a diversity in those which we need to pay attention to when we address the informal sector. But generally speaking, the literature has a tendency to focus on conceptualizations and attempts to recognize and integrate the informal sector into the formal economies. And Neuwirth looks at the value of the sector itself, while others look at what opportunities exist and what challenges face the informal sector, with others looking at the precariousness of the sector. But that is not the focus of my talk here. But generally, when you look at the attitudes towards this sector, which we already looking at as a major economic force, there seems to be different attitudes from different observers. The public, generally, this is where you go when you cannot find something to do. The government, looking at this from tax evasion, illegal aspect, while planners, which I have a background, looking at how the informal sector creates chaos, and it is unorganized and sometimes undesirable. And so there is a tendency to homogenize conceptualizations of the informal sector. And this is where the second order impacts of COVID-19 will play itself in a much more far-reaching way. And clearly, the informal sector is a major employer, and I cannot overemphasize that. And in the country where I come from, if these statistics are right, 83.5% of total employment just 2 years ago within this sector is quite significant to ignore. So at the advent of the pandemic, most questions revolve around these and more questions: tolerance, recognition and integration, legalization, how precarious it is, and little attention to the enormous value of this sector. And when you look at the government measures, during the pandemic to mitigate against impact. The informal sector was not necessarily part of that, and I will mention that briefly. So when you look at the Kenyan experience of the pandemic, clearly most of the measures you see here to contain COVID-19 were quite ambivalent to the practices of the informal sector, whether it is the school closure of public gatherings, which completely removes or deprives the informal sector of key access to business, whether it is enforcing nationwide night curfews or border closures. Most of these were quite unfriendly to the informal sector. But then the key thing here is when you look at these 7 government measures devised to buffer Kenyans against financial hardships, none of this was geared towards the informal sector, whether it is the tax reliefs or reduction in turnover tax rates or reduction in resident income, making available this amount of money, $95 million to vulnerable groups. None of this really specifically targeted the informal sector. And there are arguments that these are not formalized, the informal sector is not formalized. And so when you look at the publications I posted there earlier, really what most observers expected during COVID-19 was that the informal sector would get hit hard, which happened. And the movement and public gathering restrictions would probably decimate vulnerable informal sector players, and many informal sector businesses would close or go away. And so most of these happened, but there's something interesting. Obviously, any economist would have told you there will be a disruption of supply chains, and both supply and demand shocks will hurt the informal sector. And so most of what was written at the time was quite grim. But then really what happened with the wholesale lockdowns and quarantines? More formal businesses closed, affecting a lot of people and creating lots of layoffs. Schools closed for a year. A lot of people lost employment and became underemployed in the private and government sector. And people employed in the government sector probably working from the house. Many people within formal sector who lost jobs began to seek relief in the informal sector. So what did not have the social safety net became the place to cushion folks falling out of the formal sector. And I found this interesting, these 2 or 3 headlines: Kenya's labor market not made for the pandemic, and Kenya's informal sector cushioning folks that lost jobs. And that already creates a disconnect between exactly what is happening in the informal sector. And there is a perceived resilience in the informal sector which cannot be overplayed. And this talk is not necessarily about that perceived resilience, even though it is important to highlight why the informal sector looks like it actually went through and opened up from the pandemic successfully. But what does that perceived resilience really mean? Does it imply uniform experiences across social and spatial scales within the informal sector? That is a question that needs an answer. And that is why I'm looking to reframe the conversation to think about what can we learn from the relative or perceived resilience of the informal sector? I think that is a question that we need to ask ourselves, whether that is a real resilience or whether there are internal differences in what we think is a resilient sector. And in what ways will the impacts of COVID-19 pandemic continue to impact or to affect the informal sector as a key source of livelihood in cities? Or in other words, what will the post-COVID-19 informal sector really look like? And what adaptations will be needed in the informal sector to respond to the second order impact, which I think need attention? And how might geospatial technologies, which is something I'm familiar with and I've used for several years now, enhance local community adaptations to the new socio-economic and spatial realities in these spaces? Those are questions I think will need to be discussed as we go forward. And the way I've set my approach here is I used about a year of survey of literature and online resources and blogs, and I was planning to go to Kenya this summer, but we'll go to Kenya in summer 2022, really interested in looking at what is happening in the ground. And I was really, really pleased to listen to Erica and also to listen to Gaston's work and other work going on around the world. What I see happening in real time, however, is that there will be an expansion of the informal sector to include actors who were not previously there. More skilled actors, more educated actors, actors with access to information. Doesn't mean that the old actors will go away. There will be a new set of activities which requires more skill, more knowledge, and which will be more sophisticated. And we are already seeing a shift in attitude toward the informal sector, which is a good thing, especially from government and also from the formal sector. And the one thing I'm really emphasizing here is that the impact, second order impacts of the pandemic will not be uniform. They're going to be greater on much more vulnerable populations, especially populations that are less skilled. This will be new players in the informal sector who were previously in the formal sector, looking at the informal sector as a cushion against losses from previous employment in the formal sector, which leads me to what I'm calling preliminary arguments before really I get to the ground to look at what is happening there. So the key main arguments I'm making is that the post-pandemic informal sector is going to look like it's expanding and is going to look more sophisticated with new activities and new actors from the formal sector. And that perceived resilience and expansion may actually try to conceal inherent disparities. With these disparities could come simultaneous empowerment of those with more skill, with more access to information, with more access to services, more access to programs, and more access to resources. At the same time, that could simultaneously marginalize populations who don't have access to those things. The more, what I'm calling the more vulnerable populations. The pandemic will exacerbate those already existing disparities in the informal sector. And so the second order impact will not be experienced uniformly. They will be much more pronounced, especially among vulnerable populations, what I'm calling different social and spatial scales. And so to mitigate against second order impacts will require really a better understanding of the sector by trying to connect lived experiences, which may be in form of narratives, data points, and the resources that exist. And I'm calling for an integrative approach, if I could say, that uses those knowledges of those vulnerable populations as an information layer in the decision-making process. And participatory geospatial tools provide that alternative approach. And that is something I've used for several years. And so a multi-scale, multi-stakeholder approach, I think, would be a good platform. And to conclude, I would argue that this second order impacts of COVID-19 are going to be experienced differently. I think I already mentioned that. And the impacts are going to be more pronounced in access to and availability of critical infrastructure. And I think this is something Gaston mentioned earlier, access to critical infrastructure such as health, water, education, and credit. And the reason I mentioned credit here is just last year, when I became interested in this, I pulled these two headlines, one in September of 2020, and another one just 3 months ago. And they talk about a liaison group launching pension fund for the informal sector. And the headline this March talks about Pioneer targeting formal and informal sector with new retirement plans. And when I saw those headlines, I asked myself, what percent of the informal sector actually has access to this knowledge? And I would not be surprised that only a very small percentage is aware that Liaison Group has launched a pension fund, which is a good thing. And so my question becomes, how do we connect this information to the people? And that is why I'm talking about connecting people and data points and resources. And so impact will be more pronounced, like I said, to the vulnerable populations who may not necessarily have access to information, may not have access to these services, the programs and resources. And so it will require approaches that recognize internal differences, incorporate local experiences within decision-making systems. And so what I think would be a potential area of collaboration for me would be a way of looking at this from a multi-scale perspective, multi-stakeholder perspective, and integrating field-based participatory approaches that incorporate community experiences into geospatial tools. That way, I think we can better understand the informal sector better, recognizing those differences, then identify these populations and connect the populations to information, services, programs, and resources, and mitigate COVID-19 downstream impacts in a socially and spatially differentiated post-pandemic landscape. I'll be very happy to entertain some questions. I'm sure there will be many questions, and thank you, everyone.
Thank you so much, Dr. Koti. What wow, what a different direction to go, and a great way to kind of wrap up our discussion on livelihoods here today. I appreciate very much your desire to help us reframe this, to help us kind of break out of perhaps some of the doom and gloom that we discuss when we think of COVID second order impacts, and looking at whether it's real or perceived gains that some of these organizations are making. We have some great questions coming along. But I wanted to insert at least one of my own here today. And you speak to the potential for collaboration and trying to engage with the communities, field-based participatory approaches. So my question includes, do you have, for those in the audience thinking of trying to apply these lessons learned and these insights in their own community, do you have suggestions on key roles within the community, whether it's the municipal government, but most definitely the Department of Economics or the cadastral office that would be great, would be best to connect to? And then second part of that question is, do you have any geospatial tools or visualizations that you plan to use in working with the community and in delivering this data and these insights to decision makers, or best practices you'd share with us on kind of how do you tell this story and help decision makers and the community better understand these issues as you've researched them and make the insights you've made?
I think those are very good questions, Laura. To the first question, whether I have knowledge of who may collaborate and the stakeholders, I think when you think about, when you look at development practice and academic practice and reality on the ground, sometimes there is a disconnect. And so when I talk about a multi-stakeholder approach, I'm looking at people like myself, others who are already working on the field, whether it is in the non-governmental sector, municipalities, and in the case of Kenya, the county governments, and then the actual people on the ground. And to segue into the second question, geographic information systems actually has multiple platforms for incorporating local content, incorporating local stories, incorporating local experiences. And that way, the use of the mobile phone by folks on the ground actually can become a tool that can be used to integrate experiences on the ground.
Thank you very much. We do have a couple questions for you in the Q&A. You speak to the role of local and perhaps national community stakeholders. Question from David Capelli is, how can the WHO, UN, perhaps the US government help address equitable recovery? And then he mentions the informational session on JEDI issues. I'm not familiar with that. I'm not sure if you are. But would you like to speak to the role of international organizations and or other foreign governments that might have a role or opportunity?
I have not worked with international organizations, but my limited involvement, especially with the US Department of State, when I traveled to South Africa, was the possibility of facilitating, creating a framework for collaboration and for building partnerships. Really, the facilitating part is more important because when I traveled to South Africa with the US State Department, I was able to actually create network or build network of African geospatial scientists. And from that point, we were able to pull resources and knowledge together. So not to dismiss that point, but I think these international agencies or other governments can facilitate to bring different stakeholders together.
Thank you. This is also along the lines of international and maybe a bit beyond the scope, but Is there a role for China that you see in how they are engaging in African cities and how they might be involved in the post-pandemic informal sector?
And I want to make sure that you say China.
Yes, the country of China.
Yes. That is a different question, because when you look at what is happening, and this is quite anecdotal information, is more of a capital intensive approach as opposed to labor intensive approach. And when I look at Kenya, really, we are a very labor intensive approach. And if I were to invest in anything, will not be highways and bridges. I'll be looking at where this 80% that is producing services is. And so there is a role there, but I would call it a facilitative role as opposed to the capital intensive of building stadiums and highways.
Absolutely. Drilling down a bit further, we've got a question here. If you could elaborate a little bit more on the lockdown strategies and how those might have impacted the resilience of the informal sector.
One aspect of lockdowns is mobility, curtailing mobility, and the informal sector thrives on mobility and personal relationships. And those lockdowns just almost made that impossible. And people that I know personally that were engaged in the informal sector could not thrive because they now did not have the mobility, they did not have the space to engage in their businesses. And so the lockdowns and closures affected the informal sector in much greater depth because of the lack of mobility.
Thank you. And our final question, I think, for today, so we can get to our closing, from Robert Kinlock. He thanks you for a very interesting presentation and was asking if you could comment on what the emerging trends could mean for linkages between the formal and informal sector.
That is a very interesting question of the emerging trends of the formal and informal. One of the things that observations that I have made is that there is a lot of people within the formal sector who actually are key players in the informal sector. And so when we address the informal sector, that is the reason I'm calling for a much more finer scale in understanding the landscape, because some of the players within the informal sector are actually within the formal sector and are playing at a much higher level and don't experience the vulnerabilities that some others have. And so I don't see them as opposed or as competing. They probably could be complementary. And so it is possible that the formal and the informal could actually have synergies.
Thank you so much today, Dr. Koti. With this, I'd like to draw to a close our symposium for today. Gosh, thank you so much. It has really been a tremendous set of insights and eye-opening discussion here that you've had for us, shared with us today. And we really do appreciate your time here, just as we appreciate the time and the presentations from our 3 panelists from earlier, from our 4 lightning talks that we heard from our C2M2 partners. In a brief couple moments of wrapping up and thoughts here today, Dr. Koti, I really appreciated your final line there, because I think it ties together nicely the thread that we've seen that, to understand livelihoods, in particular to understand vulnerable communities and the most impacted by these second order economic impacts on livelihoods and informal sector, we need to do a fine scale of analysis. And really, we've heard so many of our presenters and experts here speak to the importance of local analysis and local scale understanding to inform national, regional, even global activities and understanding of these second order impacts. You also spoke to the importance of the local context and networks of working together that are working together locally and regionally to share best practices that are best suited for the communities in which you're trying to work and to help mitigate these second order impacts. It's such a tremendous undertaking to try and help mitigate economic second order impacts. Dr. Richardson started us off this morning talking about both the double whammy, if you will, of the jobs lost and food prices rising, and bringing it back to geospatial tools and technologies. Our presentations from Ms. Fikriyah and Dr. Gaston talked about the value of defining your question well and creating well-crafted data and analysis to really make a contribution on the ground to these impacts to support the communities and the key stakeholders, and to inform the decision makers so that they can best develop these political and these different ways of trying to reduce the spread of COVID, but at the same time recognizing the importance of the socioeconomic implications that things such as lockdowns and other issues that have arisen here. So really, thank you so much, Dr. Koti, as our keynote here today on livelihoods. You've set us up well for tomorrow, where we'll speak to gender. So many of our conversations have circled around to the fact that all of these second order impacts are very closely connected. I will pass it over to Dr. Lettieri to finish up our comments for today, but thank you all to our presenters. It has really been a great opportunity to learn from you, to share expertise. Thank you everyone to our participants, our attendees, and contributors as well. We've had such great comments going today and such great questions going today. I hope to see you all back here tomorrow and even on Friday for the demo piece of things. Really do appreciate the contributions that you all have made as well. Dr. Lettieri?
Thanks so much, Laura. And again, thanks everyone today. I think Laura did a great job wrapping that up and summarizing things. Just some things to think about. Please make sure you take the survey as you jump off this. We were happy to get your feedback about this. Also, just some things to think about. Please join us tomorrow. We start at, well, I'm not going to say what time we start. We start when we start because we're all over the place in terms of time zones. Please, we will be focusing on gender and society tomorrow. And just some things to consider that these second order impacts are difficult to parse out. As has been demonstrated, there's just extensive connectivity between all of them, and they all intersect. They are complex, and they are complicated, but the goal of this is collaboration. If we can set the stage for collaboration, for developing integrative mechanisms for addressing this and starting different avenues for dialogue and discussion so that we can really think where this can take us to. So with that, I'll close the session. Thank you all so very much. We so appreciate you attending, and we look forward to seeing you tomorrow. Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thanks a lot.